I know your basic position. I know what you're fighting for. You would really like a single-payer system, like the British National Health System.
We unfortunately are not going in that direction. I wish we would.
Do you really want to do that? Well, the British version of healthcare. I know these things.
I don't want to do the British
version.
I don't want to do the. I want to do the American version.
Socialized healthcare costs an arm and a leg. It's incredibly expensive, and more to the point, Congressman, it is politicized.
Well, hold on a second. Hold on a second.
Take decisions.
You don't have to take a look
treatment.
at. I understand your experience. You don't have to take the experience of Britain to understand this. Look at Medicare. For the last 44 years, here's what it's done.
It's bankrupt.
It's taken people who were at 33% poverty when the plan was passed. Now have it today. It's one of the most popular programs around.
It's bankrupt.
You say it's bankrupt. There are cost problems for private insurance, public insurance. All insurance has a cost problem. The only question is,
think the government can control costs?
Well,
is government
do you know what the overhead is of the Medicare system? 1.05%. Do you know what private insurance is? 30% in overhead and profits. Given a choice how I'm going to improve health care, I'm going to take it away from private insurance profits and overheads. Wouldn't you?
You would eradicate private insurance?
Yes, I would.
And give it all to government?
Yeah, I would make Medicare. How old are you, Stu?
Forget it. You would give it all to government, okay?
Look, here's what I would say. Okay. Here's what I would say. We have a line for Medicare 65. Why not 60? Why not 55? Why not 45? If we think the program is efficient, and no one could deny that
I don't think it's efficient.
A 1% overhead, you find me a business can operate that efficiently.
What efficient business is going bankrupt?
Wait a minute, you keep saying bankrupt. It is true. Hold on a second.
In deficit.
Hold on a second. Your insurance plan went up $1,000 last year, okay? Yours did. Yours here at Fox News went up $1,000. What I'm saying is all health care has a problem with cost. Medicare is growing slower than the private insurance plans. Why? Because of their efficiency. They don't have to give money to shareholders. Why should we be defending shareholders?
Efficient?
Medicare, 1.05%. I can show you the documents.
When Medicare was first introduced in 1965, they said it would cost $10 billion by 1990. Wrong.
You know why?
Wait. No, I'm looking at government projections.
Well, would you like to know why?
What would you do?
Would you like to know why it's exceeded government projections?
We are told that this program, out of the Senate or the House, is going to cost $1 trillion over 10 years. Do you trust that?
There are a lot of Republicans and maybe some libertarians like yourself.
Do you know what you're doing?
Hold on. Here's the thing. You've asked me now 4 questions. I want to answer them all. First, you say, is it more efficient? It clearly is. 1.05% overhead and profits. Your insurance company, I don't know what it is in the magnitude of 30% for overhead and profits. Why is that? Because they have to take some of their money and give it to shareholders.
No.
Medicare doesn't have to do that.
They have to charge more.
Of your insurance company.
Private has to charge more because the doctor can't get enough money out of Medicare and Medicaid.
No, that's not why they're doing it. They're doing it because there's no incentive for them to control costs because there's such little competition. Look, here's the question I have to ask you. Medicare, by the way, is indeed, it has a financing problem as well, but it's holding its costs down better than your insurance company is. It is costing more. Why? People live 10 years on average longer than were projected at the time. It's a success story, the fact that more people are living longer, healthier lives.
And you think that Medicare is this plan will only cost an extra $1 trillion over the next 10 years.
If I want to control costs, the first thing I do is overhead and profits.
You believe that?
I don't take it out of health care like insurance companies do.
Spoken like a Brooklyn socialist. Take away the profits from private enterprise.
Look, let me ask you, is Medicare socialism?
Do you think I came to this country to be ruled by guys like you?
Is Medicare socialism? You want to get rid of Medicare, and a lot of the people against health care do. I want to preserve it and grow it.
Socialized medicine.
No, because government does not control the means of production. You don't know what socialism means. Government does not control the means of production. We still have doctors and hospitals. Medicare works. You may not like it because it's a democratic program, and I'm proud of that. You know what?